Hi, I'm Dr. Bruce Evans, orthopedic surgeon at St. Mark's Hospital. I'm going to describe to you the reverse total shoulder arthroplasty. The shoulder joint is a highly mobile ball and socket joint made up of three bones: the humerus, or the upper arm, the clavicle, or the collarbone, and the scapula, or the shoulder blade. The humeral head is the ball-like structure at the top of the humerus. The clavicle runs between the breastbone and the top of the scapula. The scapula is a flat, triangular-shaped bone that forms the back and the top of the shoulder. The glenoid cavity, or the socket, is a shallow depression in the part of the scapula closest to the arm. The ball of the humeral head fits into this socket. Articular cartilage is a tissue that covers over or caps the humeral head, and it also lines the glenoid cavity. It allows the joint to glide smoothly. Four muscles start at the scapula and run toward the shoulder joint. These muscles are attached to the humerus with tendons, which are strong cords of tissue that connect muscles to bone. These tendons form the rotator cuff, which is a capsule that supports the bones of the shoulder joint, and it holds the humeral head within the glenoid cavity. The cuff sort of covers or cuffs the top of the shoulder. The rotator cuff gives the shoulder joint stability, keeping the ball and socket in proper position. Rotator cuff also gives the shoulder joint its wide range of motion. Sometimes the shoulder joint can become severely damaged from disease or injury. For example, in arthritis, the cartilage of the joint can start to erode, causing pain and loss of mobility. Injuries to the rotator cuff, such as a tear, can also cause pain and decrease the shoulder joint mobility. Over time, a shoulder with a damaged rotator cuff may develop cuff tear arthropathy. That's a condition where the shoulder joint develops arthritis due to abnormal motion and instability from the tear. Severe disease or injury of the shoulder joint may need to be treated with a joint replacement. A standard shoulder replacement uses manufactured materials to create a new ball for the head of the humerus and a new socket for the scapula. However, when there is disease or injury of the shoulder joint and it's complicated by a severely weakened or injured rotator cuff, a reverse shoulder replacement may be necessary. A reverse shoulder replacement allows the deltoid muscle in the arm to take over the movement of the shoulder joint from the weak and injured rotator cuff.